Hello guys, today's topic is infectious canine hepatitis and we are discussing this topic under veterinary pathology, infectious pathology. Okay, so the topic is infectious canine hepatitis. This disease is also known as Robert's disease, hepatitis canis, canis adenovirus infection. So the most important synonym for it is Robert's disease. So in examination, if they don't ask infectious canine hepatitis, they will definitely go for the Robert's disease to confuse you guys. Okay, so remember the synonyms of the disease. So moving ahead to the introduction of the disease, infectious canine hepatitis is a worldwide contagious disease. Okay, it is a contagious disease of dogs which is characterized by slight fever and congestion of mucous membrane to severe depression, severe reduction in WBCs, okay, and deficiency of blood clotting. So if we talk about reduction in WBCs, so what is this? In all of the viral disease you will see leukopenia. Okay, what will you will see? Leukopenia. But in case of bovine epimer fever or 3-day sickness, what you will see? You will see increase in WBCs. Okay, so just tell me what is the terminology we use for increase in WBC. Now coming to the definition. Definition is the most important essence of the disease because it will contain your etiology, your lesions and everything. So it is a acute. What kind of disease? Acute disease with highly contagious disease and highly contagious. It is highly contagious, acute and highly contagious disease of dogs caused by canine adenovirus. So what it is, if you write canine adenovirus, it will be considered wrong. So if someone asks you the etiological agent, you have to write canine adenovirus 1. So you will also search. You have two assignments. One, what do we call when there is increase WBC? Okay, and the other assignment is what disease is caused by canine adenovirus 2. Okay, and it is characterized by necrotic lesions in liver. That's why it causes hepatitis and intranuclear inclusion bodies in hepatocytes. Now, in recent year, the disease has become uncommon with routine vaccination. So, there are vaccines like, if you know, definitely 7-in-1 and similarly 9-in-1. So, these vaccine contain canine adenovirus 1 and other microorganisms also. Okay, we'll discuss it later. What are the components of 9-in-1 and 7-in-1? So due to routine vaccination, the disease has been become uncommon. So it is discovered in 1950 by a veterinarian called Carl State Roberts. That's why the disease is Roberts disease. Now the ICS was distinguished from CD. कैसे हमने इसको CD से डिस्टिंग्विश किया? किसने किया? रॉबर्ट्स ने किया. कैसे किया? इन्होंने ferrets यूज़ किए थे and he came to know that ferrets are resistant to ICH. They are resistant to ICH but susceptible to CD. ICH occur worldwide. Now we're talking about etiology. We already discussed that it is caused by canine adenovirus 1 under mist adenovirus. Canine adenovirus causes C. You got the answer. Infectious tracheobronchitis in canines. Okay. Non-enveloped means, so if it is non-enveloped virus, okay, these are the part of microbiology, but we are taking it here only. So non-enveloped, so you have to tell me about its lipid solubility. Okay, I mean non-enveloped virus will be lipid soluble or not. Okay, hexagonal virions, these will come under the microbiology sessions which we will take afterwards, and icosahedral capsid. Now genome consists of double-stranded linear DNA. Viral replicate in the nucleus. Okay, that's why it, what we'll see in this disease, we'll see intranuclear inclusion body because they replicate in where? Nucleus. Okay, and intranuclear inclusion bodies, where you will see these in, it's important, you can't only say intranuclear inclusion bodies, you have to write the location also. So intranuclear inclusion bodies in hepatocytes. Okay, so as I'm new in this, so don't go towards my writing. Now variant produce basophilic, so these are basophilic, these intranuclear inclusion bodies are basophilic. Now host range, dogs are the main host range, generally immunocompromised dogs, generally in affected in endemic area. So the assignment number 2, because you get to know what is caused by canine adenovirus 2. Okay, so the assignment is what, when you will call endemic. Okay, so define, see this will help you in comparative study. Okay, define, what you have to do is to define sporadic, epidemic, endemic. Okay, so what are the difference in these? स्पोरेडिक, एपिडेमिक, एंडेमिक एंड वन मोर विच इज पेंडेमिक. सो पेंडेमिक तो आप सबको पता ही होगा. ठीक है. ऑल्सो इन वाइल्ड एनिमल लाइक फॉक्सेस, बियर्स, वॉल्व गेट इफेक्टेड. Transmission. The transmission is by contact, inhalation, and ingestion. Common routes: urine, feces, nasal secretion, vomitus, etc. can be can act as transmission agents since numerous copies of the virus particle can be there. Recovered dogs जो है वो urine में virus secrete करता है more than 6 months तक. See, so these are, what will say them? What is the terminology used? Carriers. These are carriers. Okay. Now moving ahead, ingestion of urine, feces, saliva is the main route of infection. Virus may be acquired by conjunctival or aerosol route. Now incubation period is 4 to 9 days. So try to remember it if you can, else just have an idea. Now ICS is most frequently seen in dogs less than 1 year of age. Okay, this is important. Although unvaccinated dogs of ILH can be affected, this will be the question. What kind of fever is seen in ICH? Biphasic fever. So here you can definitely get a MCQ fill-ups or true false in your board paper. Now first fever due to viremia. So how biphasic fever? This is also important. How you will explain it. Biphasic fever. So the first fever is due to viremia and the second fever is due to bacterial infection or due to toxins. Okay. So you will see what secondary bacterial infection. Okay. Why secondary bacterial infection? Due to okay, because there is decreased immunity. So this is the pathogenesis. Okay, so you have to remember it because we are studying it in pathology. It's important. So what happened? Virus get entry in the body through secretion. So we already see urine, etc. Okay, so once it gets the entry in the body, the virus will locate itself in tonsils or cervical lymph nodes. Okay, then it will get to thoracic duct and viremia. What is viremia? Viremia is presence of virus in blood. Okay, so you should know what is bacteremia, septicemia, toxinemia. Simple terms, just go through it. Then it will go to eye and it will cause one of the very peculiar symptom of the disease, which is what we call is blue eye. Okay, then it will go to liver, causing hepatitis, kidney causing glomerulonephritis, and other endothelium organ causing organ failure, and it will get excreted in feces. Okay, so persistent infection, you will see hepatic fibrosis and intestinal nephritis, and this is due to interstitial nephritis is due to viremia, means virus in urine, viremia, virus in blood. Okay, so just go through it. Whatever was important we have discussed. Now hemorrhages and necrosis, especially in liver and kidney. Viremia infect endothelial cell and spread to different organs. Chronic kidney disease and corneal clouding, known as blue eye, result from immunocomplex reaction following recovery from acute disease. This is important point. Okay, it could be asked in your exams. So we are discussing blue eye. It can come under a short note or you have to discuss while we are discussing the disease. Okay, so this disease is very much important. It is type 3 hypersensitivity, may be seen during convalescent period in about 20% cases. Okay, how much in cases? 20% cases. Okay, now 2 to 3 weeks following vaccination with modified live canine adenovirus. So whenever you use live vaccine, there is a chances of reversal. Okay, so it can cause the disease. Okay, that's why killed vaccine are more safe. So it is characterized by an anterior uveitis, and go through the term. What assignment number 3, what is uveitis? Then several severe damage to corneal endothelium, as the virus is endotheliotropic, and profound corneal edema, which is seen as blue eye. Okay, now on about 4-day, virus enter in the aqueous human from blood and replicates in corneal endothelial tissue. By 7-day, anterior uveitis and corneal edema develop. Circulating immune complex deposit on the corneal endothelium. Immunocomplex hypersensitivity type 3. Okay, result in complement activation. These all things you will get in microbiology. Neutrophil chemotaxis means attraction of neutrophils through chemicals. Frustrated phagocytosis means the phagocytosis will be exaggerated in corneal endothelial damage. Now disruption of corneal endothelium result in accumulation of edematous fluid in the corneal stroma, leading to corneal edema or blue eye. Now clinical sign, most infections are asymptomatic. In systemic symptoms, 3 overlapping syndromes which are usually seen in puppies of less than 6 months. Okay, so we'll see per acute, acute. Okay, dog is found dead. If it is per acute, you will find dead, either without apparent preceding illness or illness of only 2 to 4 hours. Okay, this is due to massive destruction of hepatocytes. Now acute disease, dogs survive viremic phase. Okay, they will survive viremic phase. These dogs do not survive viremic phase. Okay, fever, depression, vomiting, bloody diarrhea. It is also known as hemorrhagic enteritis. Petechial and ecchymosis, hemorrhage of gums. Okay, so you will see ecchymotic. Ecchymotic means See, you will get what is the difference between petechial and ecchymosis. Petechial are pinpoint, these are 1 to 2 mm. And hemorrhages of gums, pale mucous membrane, and jaundice. Jaundice because of hepatitis, because there is massive destruction of hepatocytes. So hepatocytes. So what you will see jaundice. 1 minute. Now, mild cases. Clinical sign is uncomplicated. Okay. Mild cases, there will be uncomplicated cases, and 5 to 10 days prior to improvement. Okay, you can see encephalitis. Okay, ICH में encephalitis भी होता है in case of foxes and known as fox encephalitis, but less common in dog. Okay, mucous membrane appear anemic, icteric, lacrimation, and hyperemic conjunctiva. Hyperemic means there is increased what blood pool. Now the disease begin with apathy. What is apathy? These all you have studied in general pathology. When we'll take general pathology, we'll go through it also. So the disease begin with apathy, followed by anorexia and increased thirst. Fever 104. Okay, and what kind of fever? Biphasic fever, vomiting, diarrhea, abdominal pain, expressing morning sound, hepatic encephalopathy, and bleeding disorder, hematoma in mouth, abnormal color of urine, CNS may be involved, chronic spasm, and paralysis of hindquarter. Now, glomerulonephritis, chronic kidney disease, immune complex, type 3 of hypersensitivity. These all are the repetitions. Okay, disseminated intravascular DIC. It's important. Disseminated intravascular coagulation. Okay, frequent complication of ICH in early viremic phase of disease. DIC may be triggered and exposure of subendothelial collagen. Okay, subsequent platelets aggregation or inability of damaged liver to remove active clotting factor. This will lead to disseminated intravascular coagulation. Okay, the urine gets abnormal color due to liver damage and kidney. Lymphopenia, we have discussed it already, and diffuse opaque glands, we have also discussed it. Blue eye. Now see, so the urine is converted to abnormal color. You can see it become dark brown, and I don't think you are able to see or not, but there are little hemorrhages here. Okay, just give me a minute. Microscopic lesions. Okay, macroscopic lesions, you can see them with your own eyes. So hemorrhages in stomach resulting from endothelial damage or loss of coagulation factors of hepatic organs. Okay, see, spleen congested and edematous, gallbladder edematous, liver, focal hepatitis, necrosis, or periportal region. So it is important. Where you will see the hemorrhages, you will see it at periportal region. Microscopic means you need microscope for these lesions. Virus is affinity for parenchymal and cover cells of the livers and endothelial cells. Okay, affected animal develop basophilic intranuclear inclusion body in endothelial cells of glomerular, tuft, brain, and hepatocytes. See, this is congestive hepatomegaly. Okay, and you can see here intranuclear, this is nuclear, intranuclear inclusion bodies. Okay. Now diagnosis, tentative diagnosis based on clinical sign, history, vaccination schedule, and other. So which generally we use in clinics. Virus isolation in cell culture like urine, blood, tissue. Antigen detection, FAT and PCR. Gross and histopathology, you can go for hematology and paired sera like virus neutralization test, ELISA, and HI. Prevention and controls, the attenuated canine adenovirus 2 vaccine provides cross protection against canine adenovirus 1. Okay, this is important. Vaccination schedule should be followed properly. We will you can see vaccination schedule video from my channel. It has been already uploaded, and proper hygiene should be practiced. Okay, treatment, no specific treatment. So whenever there is a viral disease, okay, whenever there is a viral disease, there is no specific treatment. We can't give any treatment. Okay, but we can just provide supportive treatment or antibiotics that can be given to prevent secondary viral infection, and symptomatic system and supportive treatment. Symptomatic means according to symptom. Like if there is diarrhea, you can give antidiarrheal. If there is MSS, means vomit, you can give antiemetic. There is loss of fluid due to these two, you can give IV fluids. So we will also discuss about which fluid is given where. We will discuss it later in medicine. So these all you can give. As there is, you can give hemostat. Okay, so thank you. This was all about ICH, and if you want module regarding this, we can provide that also. So thank you so much. I hope this will help. No question will come out of these slides. These slides are more than sufficient for your exams and for VCI board exams. Okay, so I hope you like the video. Like it, share it, and comment for more such videos, and we'll meet soon with another topic. Thank you.